What types of colon polyps can colonoscopy precisely find? Imagine a tiny growth inside your colon that could be harmless or might turn into something more serious. Colonoscopy is the best tool doctors have to spot these growths, called polyps, and decide what to do about them. It's like a high-definition internal camera that lets doctors see the inside of your colon in detail. During this procedure, they look for different types of polyps based on their size, shape, and surface features. The most common polyps that colonoscopy can find are called adenomatous polyps or adenomas. These make up about 70% of all colon polyps. They are important because they are considered precancerous, meaning they have the potential to develop into colorectal cancer if left untreated over time. Adenomas can grow in different ways. Some are tubular, which are usually smaller and less likely to become cancerous. Others are villous, which tend to be larger and carry a higher risk. There are also tubulovillous adenomas, which have features of both types. These polyps can be on a stalk, called pedunculated, or flat against the colon wall, called sessile. Colonoscopy can spot both types clearly and can often remove them during the same procedure for biopsy and analysis. Another type of polyp that colonoscopy can detect is the hyperplastic polyp. These are generally benign, meaning they are not cancerous, and are usually small. They are often found in the lower part of the colon or in the rectum. While hyperplastic polyps are less concerning, doctors can tell them apart from adenomas by their appearance, sometimes with the help of special imaging techniques that enhance the view. Serrated polyps are a bit trickier. This group includes sessile serrated adenomas or polyps and traditional serrated adenomas. They have a sawtooth pattern under the microscope and can be precancerous, especially the sessile serrated types. These tend to be flat and can be hard to see, but with careful inspection and advanced imaging like narrowband imaging, colonoscopy can detect them effectively. Recognizing these polyps is important because they can develop into cancer if not removed. Inflammatory polyps are another type that colonoscopy can find, mainly associated with inflammatory bowel diseases such as ulcerative colitis or Crohn's disease. These polyps are benign and not considered precancerous, but identifying them helps doctors understand the extent of inflammation and plan appropriate treatment. During a colonoscopy, doctors use various techniques like dye spraying or special lighting to distinguish different polyp types based on their surface texture and blood vessel patterns. The NICE classification system is one example that helps endoscopists tell hyperplastic polyps from adenomas and even malignant lesions during the procedure. Polyps can be tiny, just a few millimeters across, or larger than 1 centimeter. The good news is that colonoscopy allows for immediate removal, called polypectomy, which is a key step in preventing colorectal cancer. The accuracy of detection depends on factors like how well the bowel is prepared, the skill of the doctor performing the procedure, and the characteristics of the polyps themselves. In summary, colonoscopy can precisely find and differentiate between adenomatous polyps, hyperplastic polyps, serrated polyps, and inflammatory polyps. This ability to identify and remove polyps early is vital for maintaining colon health and reducing the risk of colorectal cancer. Regular screening starting around age 45 for those at average risk is recommended to catch these growths early and keep your colon healthy. Always consult with your healthcare provider for personalized advice and screening plans.